Over the last couple weeks, we've been watching and still are watching the devastation that Hurricane Harvey has left behind in Houston and its surrounding communities. And if you have felt like we have, you want to reach out and you want to help, and that's why we're here today. Dina, on behalf of Parkview, can you talk a little bit about how this has impacted you watching the devastation in Houston?
I think it's been a roller coaster of emotions for myself and for many others, and you're watching all of the media and what's happening. You go from being very saddened by the loss and devastation to you're joyful over these great stories of heroism and people saving others, and encouraged by the perseverance and grit that people have in really getting what they need. So at the end of the day, I think we're all looking at it and saying, how can we help? We're separated by miles, but we're just motivated to help others.
Yes, yes. And Sean, you just moved here in June. You're new to the Fort Wayne community. Welcome.
Thank you.
But you lived in Houston for 23 years and you still have immediate family down there and lots of friends as well. What are you hearing from Houston?
It's pretty devastating. Seeing the footage is nerve-wracking, having my kids there. A lot of friends have gotten flooding, a lot, more than half that I've spoken to. It's really torn the city apart in a way, but I'm certain brought them together as well. A lot of people are helping one another, which is great to know and great to see.
Dina, last week, Parkview and its coworkers decided to make a donation to the Texas Hospital Association. Can you talk a little bit about the organization and how those funds provide relief?
I think one of the greatest things about working in healthcare is this passion and desire to want to serve other people. And so many of our coworkers had reached out saying, how can we help? What can we do? And so being able to offer that opportunity to help those individuals who right now are spending their time helping other people. They're healthcare workers. They are tirelessly working to make sure others are taken care of, despite what might be happening in their own personal circumstances to their homes and with their families. So Texas Hospital Association set up this fund similar to maybe Parkview's Employee Emergency Assistance Fund, where those in need can reach out and get dollars that can help them. But that seemed like a great fit. It's wanting to help those in that healthcare family, helping brothers and sisters in healthcare. And I know so many of our coworkers gave us great feedback that was a great place to put our money towards.
And Sean, when you lived in Houston, you went through hurricanes, you've worked in hospitals, helping during those times. What is it like? And I'm sure you still have old coworkers that are going through that now.
Well, whenever you join a hospital in Houston, you join either the ride-out team or the recovery team. If you're ride-out about 24 hours before the storm hits, you're to report to the hospital, and you're there until it's done, and until the recovery team shows up. You're working 12 to 14-hour shifts, and you're there the whole time until it's over. It can be 3 days, it can be 6, 7 days. You see a camaraderie develop and unity, people pulling together to do anything they can to take care of patients, help support the physicians and the nurses. You can't always reach out and contact your family, so that's very hard. And when you do, you're just glad they're alive and you're glad they're safe. Otherwise, you're doing everything you can to take care of patients and hopefully bring your mind down and get some rest so you can start another day tomorrow.
Well, our hearts are definitely with your friends and family that are still down there, and we'll be thinking of them in the upcoming days and weeks. Dina, in your opinion, as a community, what can we do to help? People are really feeling the need to reach out. We see another hurricane moving in towards Florida right now, and they're facing a similar situation. What can we do?
It's certainly hard to watch from Indiana and know that all of this is happening, but it is about finding what speaks to you as an individual. If there's interest to join in helping the hospital healthcare family, then I think Texas Hospital Association is a great place. I think there's lots of options with the American Red Cross. For those that may not have the means, giving blood is another great way to help, because we know that is absolutely going to be a need when there's devastation like this. It does come back to helping find what speaks to you as an individual, but it's getting started finding ways to help. The IRS just published in the last few days a notice that gave employers the ability to have coworkers donating their vacation time. And so we're going to be announcing here very shortly within Parkview the ability to donate vacation time to help Texas Hospital Association or the Red Cross. And that's just another way for people to be able to help.
Thank you to the both of you for joining me in on this conversation. If you're looking for ways to donate, there's still a great need, and in the comments below, there will be links on how to donate.